Alzheimer's has robbed Linda, a former sub-editor and artist, of her ability to communicate and walk unaided, and of the future she and her husband John had planned. He now does everything for her, while also looking after the couple's daughter who has Down syndrome. Lockdown meant Linda's routine had to change, and she's been unable to access the specialist daycare centres she used to.
She doesn't recognise people anymore. She doesn't talk as much as she used to talk. She, when she does talk, you can probably hear in the background, it's more mumbling and words that don't make any sense. At the start of lockdown, if you asked her what her name was, she would tell you. She can't do that now. It's just a general deterioration through a lack of mixing with people.
It's hard to know whether Linda's cognitive decline is due to a natural progression from Alzheimer's or months of social isolation or both. But dementia charities say her situation is far from unique, and people with dementia have been disproportionately affected by COVID-19, with official figures showing the disease was the most common main pre-existing health condition in deaths involving COVID between March and June this year in England and Wales. At the same time, visits to relatives living with dementia inside care homes were stopped to try to halt the spread of the virus. Around 850,000 people in the UK are living with dementia. Lockdown and social distancing has been particularly challenging for sufferers and their carers and fuelled feelings of isolation and loneliness.
I'll get her up and give her a little walk.
Dementia UK says calls to its helpline rose sharply during lockdown. Leslie is a specialist dementia nurse helping families like John's.
And they are like the invisible army, aren't they? Because carers, I think, quite often, they quite often say, even pre-lockdown, that they can feel quite isolated and kind of it can be quite a lonely existence. And I think lockdown's only amplified that. I think some of the areas that they've struggled with is their needs not being recognised in terms of the level of care that they provide, and some of the respite needs that they have that they've not been able to access.
Linda and her family have faced constant trials since her diagnosis. The coronavirus pandemic has led to tens of thousands of deaths. The number of those whose lives have been changed and challenged by it, though, is harder to comprehend. Emma Hayward, Jazeera, Hertfordshire.